Welcome, everyone. We're going to go ahead and get started in the spirit of time. We want to thank you all for joining us today. My name is Jennifer Flores. I am the Blooming Health Account Manager and interviewer for our webinar today, How Benjamin Rose is Strengthening the Link Between Clinical and Community Care. Before I get started, I wanted to touch on a few housekeeping items. Participants are muted, but we encourage you all to put any questions in the chat section for our Q&A at the end of this call. This webinar is an extension of our Blooming Day, Ohio event that took place 2 weeks ago that brought thought leaders from community-based organizations, large healthcare workers, large healthcare systems, and community and government entities to have impactful conversations to invoke change and collaboration. A theme that I took from Blooming Day, Ohio was that change and collaboration does not happen without conversations and without continuous conversations, which is why we're here today. Today we are highlighting Benjamin Rose Institute on Aging, an organization based in Cleveland, Ohio that has served older adults and caregivers since 1908 and is known for their direct services, cutting-edge research, policy and advocacy work, and education and training. I'm so happy to be here with Benjamin Rose's Director of Strategic Partnerships, Lisa Weitzman. Lisa is a leader in implementing programs and services that impact social determinants of health and has successfully utilized research to help fund countless amounts of programs, projects, services, and additional research that has truly impacted countless lives. Lisa, would you please introduce yourself and tell us a little bit more about your role at Benjamin Rose?
Absolutely. Hello, everyone, and thanks so much for joining us and for welcoming me here today. So, as Jennifer said, my name is Lisa Weitzman. I'm the Director of Strategic Partnerships here at Benjamin Rose. I am a licensed social worker by training, and I have a unique role in that my job is really about how do we, as a community-based organization, better collaborate and align with our healthcare providers as well as our healthcare payers to just figure out not only what sustainability looks like for us as an organization, but at the end of the day, how do we really provide best care for our older adults and their family caregivers? So look forward to diving into the conversation.
Amazing, thank you. Actually leads us to our first question. How does Benjamin Rose partner with healthcare and hospital systems today?
Yep. So we do it in a multitude of ways because, as I said, it's not only about sustainability, but it's really about delivering best care for our clients and their families. And so some of our partnerships with the healthcare system are basic referrals. They refer their patients to us. We, in return, send our clients to them for services in the community. So some of them are really very basic. We then, though, have explored partnership and are involved in partnership in lots of other ways. So, as Jennifer said, part of what Benjamin Rose does is we have a large research organization. So we have done collaborations with our local healthcare partners from applying for research grants together to receiving grants and figuring out how we're going to implement them together, really working collaboratively around how do we solve for the particular, usually it's a social determinant of health challenge that the grant is we're looking to address. We also have done a lot of work under national policy models like GUIDE, which is another way that we are working closely with our healthcare partners to serve our dementia family caregivers and their loved ones who are living with dementia. And lastly, we actually have some relationships where our staff is embedded on site, which really gives us that ability to, in the moment, be able to work collaboratively with a patient to address not only their health-related needs, but their social care-related needs in that moment, at the same time, working together as a team. I will say the one thing that we see in our healthcare partnerships is they're very much partnerships that are built on individual relations or individual relationships, or maybe department relationships, but we still, as a community-based organization, struggle to get out of that siloed approach to being able to say, we are a systems approached organization that has a system-wide relationship with our healthcare partners.
Awesome. I know you mentioned you work with Guide. What are some other partners that you work with, or what do you look for when you're looking for partners to collaborate with?
Yep. So I would say we look for lots of different things. One is that as a community-based organization, we are very much mission driven. So our mission at Benjamin Rose is to serve our older adults, our most marginalized and most vulnerable older adults and their family and friend caregivers. So for us, aligning around our mission is one of the most important things we look for in a partner. And then we also look for partners who are really want to partner. And I know that sounds redundant, but sometimes these relationships are very much a David and Goliath situation where there's the healthcare system that has so much power and they need something from a community-based organization, oftentimes to check a box, as opposed to really a commitment to providing holistic wraparound care for their patients and their families. So really looking to assess, what is that healthcare partner looking for? Is this a collaborative relationship where we both have a voice and a say in how this relationship goes forward?
Amazing. And you mentioned that you're working, one of your partnerships is with dementia care and dementia patients and their caregivers. I know that's a branch of social determinants of health. You also mentioned social determinants of health. How do these specific programs and partnerships address those social determinants of health that you are looking for?
Yep. So I think the best place to start to understand all that we provide. So we as an organization provide a lot of direct practice services into the city of Cleveland to address that 80% of health that happens in the community. And at the top of it, or where it all starts, is this as a approach that is comprehensive and equity centered. And so when you start with that approach to how we deliver care, that immediately is that connection to the social determinants of health. So if we start at a very practical level, we deliver services that address food insecurity, that address social isolation, that address financial health issues and housing issues, as well as caregiver support and care navigation. So at a base level, those are our programs that address social determinants of health. But if you dig a little deeper, it's also that commitment to research informed, evidence based programming that's come from that partnership between our research side of our organization and our practice side of our organization. So the research team is designing programs that we're trying out and implementing on our side, and then letting them know what the impact of it is, and back and forth. And so again, that helps us to move forward in these conversations around the social determinants of health. And I think lastly, it's that overarching understanding and commitment to addressing the systemic injustices in our systems and the health disparities and health inequities that when we see them in an older adult, it's the accumulation across a lifespan. And so how do we think about those lifespan issues to continue to try to go more upstream to address them earlier on, so that by the time somebody is an older adult, the social determinants of health, those health related social needs, have in some sense been addressed or mitigated.
Amazing. Um, what impact have you seen through these partnerships, or what value-based care arrangements have you seen that are tied to these partnerships that you work with? I know from our conversation you see it every day, but be care to share.
Yeah, absolutely. So when I think about value-based care arrangements, my thought as a community-based organization goes to, what is the value of these partnerships on the individuals whom we're serving? And so I'm going to answer, if that's okay, answer your question through that lens of what does value mean for us? And so at the highest level, it's that the ability to provide seamless wraparound services, that ability to have in essence, a one-stop shop for patients and family caregivers where their health-related and social care-related needs are addressed. And they know that there is coordination and collaboration and conversation between their providers, so that they're not trying to navigate it themselves. They're not trying to navigate these systems that are hard to navigate in the best of times, let alone when you're in a healthcare crisis. And so what that ultimately does is it improves the patient experience. The experience for them is less fragmented, it's less confusing, and so they feel as the patient that everyone is working together toward their shared goals. And that sense then reduces the sense of burden, the sense of stress on our older adults, and certainly on the family caregivers. So that's one huge value. And ideally, it makes people more engaged in their own health. It makes them better able to manage their own healthcare concerns because they're not spending so much time trying to navigate systems that aren't talking to each other. It also gives them better access to experts. So maybe I've got that expert who can help me understand from a clinical side and a medical side what's happening in my brain, but being able to work with people in the community are going to help me manage how does that present and what does it mean? How should my house be set up and how am I going to access food and who's going to care for me and what does that long-term care plan look like? Being able to develop that comprehensive care plan that's not just the medical side, but it's all the other pieces and parts that enable someone to age well in our community. And so I think that's really where we see the benefit and the value of it. Obviously, we see it also in reduced hospitalization, reduced use of emergency departments, other types of cost saving that coordinated care produces. And that is wonderful. And that's the value to the system. But I think it's also so important to really put front and center what is the value to the people whom we're serving, and how do we keep that benefit in the forefront of all of our conversations?
Yeah, that's a perfect segue into gaining those referrals, patient referrals from healthcare systems. Can you talk a little bit about what that looks like and how do you all engage those patients after they are referred to you?
Absolutely. So I would say, I always laugh and say that I go to the shoe repair multiple times a year to replace the soles on my shoes from pounding pavement with our healthcare partners, because I find that because so many of these relationships are person to person as opposed to system, it's working within each department at each health center, whether it's a FQHC or it's a major health system, to help them understand what we do, to develop the trust that we are a reliable community-based partner, and then to find ways to encourage them to refer their patients to us. So we do anything from um, basic referral forms, giving them a direct phone number that they could call so they're not going to our central intake, but they're coming directly to the program that they want to work with, to working on referral platforms like Unite Us, that systems are using as well. But what we're also really finding is the value of the warm handoff. So how do you capture the trust that somebody has with their physician and transfer to the community? So what does that look like in working hard to really hone in on a warm transfer? And again, to capture that trust that people have. The other thing we found is that while it's wonderful for health systems to give out our name to their patients and their families, oftentimes it's like giving somebody a magic wand when they're in an appointment, right? And you hand them the magic wand and you say, when you get home, wave this wand around your house and everything that's causing you anxiety and stress will disappear. And most people, by the time they get home, and they get sucked back into the reality of their lives, forget that they have that wand in their back pocket. And so we like to think of ourselves as that wand. We really can provide help, and our programs are all offered at no cost. So it's not like there's a barrier around economics that's getting in the way of people accessing us. And yet it's still so hard for people to call. And so we have said to our healthcare partners, refer to us. Let them know that we'll be calling, because if we've done one thing well, we have taught our older adults and their family caregivers not to answer the phone from a number they don't recognize, which is wonderful from a safety perspective, but hard when you're trying to reach out to somebody for the first time. But let them know they should expect a call from us. Put the burden of responsibility on us to make that call, to do the outreach, and to engage with your patients.
Yep, that makes perfect sense to me. And I know that you kind of touched on some challenges like overcoming trust, getting them to answer the phone, getting them to connect with you. Are there any additional challenges that you see in when connecting with the client are taking those referrals from those healthcare systems?
I think one of the biggest, there's several challenges that we face, and I think they all get back down to the question of around stigma. So there's a lot of stigma around aging. There's a lot of stigma around talking about end of life. a lot of fear, understandably. There's a lot of stigma around asking for help. And so, I always laugh and say help is still a four-letter word in our society. But as a result of all of those accumulated stigma, and then you layer on lack of trust in the systems, historically, generationally, what have you, and then you layer on the stress and anxiety of caring for another person. Those really become the challenges that we face when trying to engage people in services. And lastly, I think when we think about our caregivers, we've also, in our world today, self-care is oftentimes equated with selfish. And so trying to engage a caregiver in a program that's going to actually help them take care of themselves so that they can better take care of the person for whom they're caring. Again, there's that challenge. There's so many challenges to overcome that have nothing to do with the healthcare system or the community-based organization, but it's everything else in our environment today.
That makes perfect sense and something that I see as a common challenge with most CBOs and most even healthcare partners that we do have. Um, Once a referral comes to you and you make contact with the caregiver or the individual, how does Benjamin Rose personalize that outreach to meet the unique needs of the patient that's being referred?
Yep. So it depends where they're coming in from. So if somebody's coming into our general intake number, we have an outreach or intake specialist, really, and she calls every single person that's referred to the organization. We have an organizational commitment that we'll try 3 times to reach every new referral, and we try in different ways at different times of the day, whether it's email, mail, phone call, what have you, trying to engage people in reaching and accepting the phone call and to really engage in taking care of themselves and accepting the help for whatever is going on to break through that denial that really help is necessary and I'm willing to take this next step. Um, and so, so that's one way. When I also look at our program, our individual program, our care navigation program, where referrals come directly to us from the healthcare system. Again, it's very much of a, let me continue to reach out to you. Let me continue to find ways and times that are best to communicate with you. I think one of the challenges that we face is that we don't have a way yet to gauge someone's readiness for change. And I think in order to really fully embrace the programs and services that any organization offers, at some level, it's saying, I'm willing to do something different. And until we have really perfected how we evaluate that motivation for change at the front end, it's going to be harder for us to engage people in midstream.
Yeah. Um, and you mentioned that it takes time to connect with these patients, and it's not always just a one call item, right? It's not always
Absolutely.
we call and that's it. Everything's solved, every need is addressed, every service is provided. How do you currently track follow-ups and then determine that after a client or patient receives those services, how did they benefit from those services?
Yep. So because we have a research organization at the heart of Benjamin Rose, we do a lot of work on data collection, data management, data tracking, what have you. So we have an internal intake system called Ben Rose 360, where anybody who comes has any contact or connection with our organization is entered into that. That enables us to monitor all of our incoming clients and to monitor all that's happening from an intake perspective. And people are open and closed in that system based on whether or not they've engaged in services, whether or not we've been able to reach them, what have you. That's all encased in one system that every part of our organization uses. So then we can go back at a higher level and pull the data. How many referrals came to our organization from a particular healthcare partner during a particular time, and what was their engagement? What was the engagement level of those referrals? The other thing that we do is that each department in our organization also has its own, basically EMR, electronic medical record, where we track what each person is doing, the progress that they've made. And so we're able to then go in and run reports and say, this is the number of people that enrolled, for instance, in our care navigation program. These are in our program, we look at 35 domains of life that are impacted by chronic health. These are the domains that have been most frequently checked. These are the services we've been able to provide, and this is the outcome that we've been able to see as a result of people being in our program. So we are very much attuned to it, and we really have to be, because we are predominantly grant funded, and those grantors are looking for what is the data behind the dollars that we're giving to you, and how are you utilizing those dollars effectively.
Makes a lot of sense and actually brings me to my next question about those grantors. What are some challenges when presenting the data to them? What does that look like? What do you present to them that makes them happy and go, yes, this is what we want to keep
Yeah.
continue funding?
I think that's a great question. And I think it's still not, we're constantly looking to say, how do we stay ahead of this? So our organization is really funded by what we call a patchwork quilt of funders. And so that's wonderful. And we are so grateful. But every funder tends to have their own priorities. Every funder has their own metrics by which they want us to evaluate their work. And every funder has that right to change midstream what their values and priorities are for funding, which as a community-based organization makes it challenging from a sustainability perspective, because you can be well into delivering something, the grant is ready to renew, and the funder says, this has been amazing work, but we're switching gears. And so all that work that you've done to get the program off the ground may not go anywhere if you lose the funding source for it. So I think the challenge for us in terms of the getting the data is making sure that everybody is collecting the data. We find in our program, for instance, that we have some challenges around getting all the demographics, certainly the basic ones, but some of the other smaller ones that particular funders are looking for us. It's still trying to find a way over the phone to casually ask some of the questions in a way that feels comfortable for the person that's asking it and makes the person on the other end comfortable answering that question. So um, again, getting that data and then being able to have all that together to be able to run the reports that really show impact based on what that funder is looking for.
Awesome. And I know we
Oh,
have
and just
touched
one
on.
other thing, and we deliver it. And I think the one other thing that I think is so important for community-based organizations is that oftentimes with our healthcare partners, they're looking for a health related outcome, right? Is it less utilization of the ED? Is it less inpatient readmission, what have you? But as a community-based organization, we oftentimes don't have access to the health related data that we need to prove that our programs are working. So that becomes a challenge. And I think in the healthcare system, they're looking for solutions that oftentimes 30 days. If I give you this medication in 30 days, I should see a difference in how you present. And the challenge with a lot of our community-based social care need programs is that we may not see an impact in 30 days. We may see an impact in a year or 2 years. And so I think, again, it's how do you take these very different measurement systems, looking at very different factors, and get them to satisfy the needs of both sides.
Yeah, that makes sense. Sometimes we have to look to the future to get those connections. We talked a lot about partnerships with healthcare and hospital systems. Do you all, or does community care networks or hubs play any role in your partnerships as well?
Absolutely. So we are part of what's called a Pathways Care Hub here in the Cleveland area. The hub itself is Better Health Partnerships, and the hub has historically focused on individuals, maternal health, and individuals 0 to 3. They have now partnered with a healthcare payer who has said, let's see if we can take that Pathways Hub model and apply it to working with older adults. So we are one of the founding partners in that new collaborative, and we are just launching. We just actually hired our first community health worker yesterday, and we're really excited to really be up and running with it. But as we've also been very involved in the national conversations around community care hubs, because at the end of the day, they really hold a lot of the sustainability for community-based organizations. We don't have the capacity oftentimes to deliver programs statewide, and that's what the payers are looking for. We tend to be much more regionalized or localized. And also the challenges of contracting for us with a payer are enormous. So for instance, here at Benjamin Rose, it took us a year to sign one contract with one payer, and we still haven't gotten any referrals from them. So and we had to increase so many different levels of insurances, whether it was our cyber insurance or our liability insurance or what have you, which makes it on a larger scale unaffordable for us to continue to do that with each person, with each payer. But to be able to go to a hub and have the hub own those contracts and us be able to contract with that hub opens up this whole other world of sustainable, longer lasting funding for us. So very much a part of our daily conversation.
Amazing. And just, I would like to ask for your advice for community-based organizations that are on this call today. How would you, or what would you advise them to do to help connect? Like maybe they're nervous or they can't get into healthcare systems, are those community care networks or hubs? What advice would you give them?
Be patient. It takes a long time. So, for instance, we had started a partnership with one of our main healthcare providers here in the Cleveland area. It took 3 years of talking with them on a monthly basis, practically, for us to be able to have somebody on site with them. But it took 3 years of conversation. So these don't happen overnight. For us, I think we were helped, it sounds awful to say, by COVID, but we all of a sudden really needed each other. They really needed our support. They had a lot of people who were showing up at their doorstep who didn't have any food. And we needed a number that we could call when we had a sick client, regardless of where they got their care or what their insurance was. And so we were able to, I think, expedite our partnership because of that. Um, but also it's thinking about who do you know, who can you leverage? So we now do a lot of work in the HIV community here in Cleveland, and we've been able to partner with our healthcare systems because we started being just joining in the conversations around HIV and aging and recognizing that there was this gap in services. And so by establishing ourselves and being seen, I guess, in all of the places where conversations were happening, it started to build that trust that we're not just here to try to grab business. We're here because we're committed. We're here because we really want to do this work and we believe we bring value. And slowly but surely, we've been able to build up those partnerships. So I really believe it's about the networking, it's about the relationship building, and it's about patience.
Awesome, and I definitely agree with that. Will say just a plug for Benjamin Rose that I visited Ohio. It was my first time in Cleveland a couple of weeks ago, and I don't think not one person that I talked to didn't know who you all were. And that also goes to national, why, right? We attend a lot of conferences, and Benjamin Rose is always there. And again, at the conferences, I don't think there's one person who doesn't know who Benjamin Rose is. So I would encourage everyone on the call to follow them on social media and LinkedIn to see
Thank
what
you.
they're doing and where they're going and how they're getting their name out there. But I did want to turn our um, our focus to the chat for some questions that some members have. The first question here is from Aubrey Balcom. How are you working with partners on financial sustainability?
Well, that's a great question. So, and that still seems to be a sticking point for us. So, right now in our partnerships with the healthcare providers, most of the funding for the services that are delivered are coming from our funds. So, let's say that healthcare system A refers Miss Smith to us. The services that we provide for Miss Smith are funded by the grant funding that we as Benjamin Rose have to deliver the services that we deliver. So we don't have currently healthcare providers who have a financial skin in the game, for lack of a better word. And that's something that we're really trying to think through, like, how do we start to develop that? Um, then there's the payer conversation. And again, how do we take our work and not just be a continual pilot project for the healthcare world? So we participated in something over the last 5 years. It's just coming to an end, called the Collaborative Approach to Public Goods Investment. This is a national effort to bring together healthcare payers and healthcare providers in a community and to have them invest in one social determinant of health where they think that if they have a collaborative, concerted effort to invest in one thing, that they can actually move the needle. So when that program came to Cleveland in 2020, we were selected as the social determinant of health intervention that CAPG would invest in our community. And that was in our medically tailored meals program. And so we had 2 healthcare systems and 3 payers that were a part of it. They each contributed an unknown amount of money. We, as the community-based organization, were not ever informed of how much any one partner contributed, and United Way acted as the broker for the whole relationship. So this was a way to have the healthcare system and the payers say, we know that these social determinants of health are important. We know we can move the needle if we work collaboratively together. And I think the challenge has been now what? Because many of the payers are saying, well, let's go and do another pilot. And we're saying, oh my goodness, we just did a 5-year intervention with you. We have all this data. How do we keep these alive? How do we keep them moving forward? And that continues to be a huge challenge for us.
And thanks for that answer. Not always an easy question to answer. The next question we have here is, how have you found success in noticing when someone is motivated to make a change? And what are those factors you look for?
Yep. So that's a great question. And I think that noticing those factors for motivation to change comes from a relationship. So haven't figured out how in that first call and an intake call we can assess it, but it's actually working with that client when they start to talk about. So we start oftentimes with questions: what does a good day look like for you? What keeps it from being not a good day for you? And then using that opportunity as a way to help understand what type of change they might be willing to do to get from what's not a good day to being a good day. And then really digging in, using a lot of motivational interviewing techniques to try to open that up and to get them to say, wow, maybe some of the barriers that are keeping me from having that good day aren't external barriers, they're internal barriers, they're internal fears. And then how do we address those fears? How do we normalize those fears? We see a lot of that in terms of caregiving with people and the concern about bringing help into the home or looking for a higher level of care for somebody because of commitments we've made at the altar or promises we've made to our parents. And so opening that up and really exploring it and then helping them to recognize that if they really are motivated to have a better day, if they really are motivated to ensure that mom, dad, spouse, whomever is getting the best care possible, what are they willing to change in their own behaviors to reach the goal that they themselves have set? So it's not getting them to reach a goal that we have. We clearly recognize that until they lose it in the court of law, people have the right to make really poor decisions on their own behalf, which is a hard pill to swallow. But if you can swallow that pill and say they get to make the choices that they want, how do we remain person-centered enough to expose where there is that opportunity for us to help move them just a little closer to the goal that they have set for themselves?
Yeah, that makes a lot of sense. I actually had a question for myself to ask you. I know in my community where I grew up, it was very much, I don't even realize I am a caregiver. I don't even realize that I need help or these services exist. How do you help them bridge that connection that I am a caregiver and I do need XYZ help?
Yep, and that's something that we've talked a lot about. So we talk a lot about, is it the name caregiver that's keeping people from the conversation? Because you're right, most people don't identify as a caregiver. They identify within their role in the family. So do we need to think of different language? And we've never, to be honest, come up with a word that we think is any better or more effective than caregiver. So then we take a step back and say, okay, this is where education comes in. So we do a lot of education out into the community, talking about things that people don't even necessarily understand are caregiver related in that moment. But through that conversation, we start to introduce them to the idea that what you're doing is actually caregiving. If you're running errands, paying bills, doing the cooking, going to doctor's appointments, those are inherently caregiver related functions, and to start to think about yourself that way in the best sense of that word. And then also to think about, how do you get back to being that relationship? And so really working with people. And then we do a lot of work with organizations to say, how do you create a caregiving culture where it's okay to talk about caregiving in the workplace? We know that for most people, they won't talk about caring for an older adult when they're at work. You go into anybody's office and there's lots of pictures of their children and their old dogs and their young cats, but most people don't have pictures of their parents in their office. Even here at Benjamin Rose, where our whole organization is devoted to issues around caregiving, I was for a long time the only person who had a picture of my parents in my office or on my desk. And so we started an effort. We called it take your parents to work days where we had people bring in pictures of their older adults in their lives and talk about the stories behind them. What did you learn from them? What was the best piece of wisdom that you got from that person? And really starting to create a space that normalized talking about older people so that people felt comfortable seeing themselves in that role as caregiver, taking advantage of the benefits that the organization might offer to support them. And then again, just talking about it in a way that made people realize I can be a caregiver and feel safe here in my workspace.
Awesome. That's amazing. I believe Marina also had a question.
Yeah, this one came in on the Q&A, and we were asked, we haven't started partnering with any healthcare systems. Do you have any advice for people who are just getting started?
Um, be brave, be courageous, be persistent, and start with some place where you have an easier in. So maybe you know somebody who works in a particular part of the healthcare system. Having that conversation, asking them, how do you work with whatever population it is? How do you handle that issue? How do you screen? Help me to understand how you screen for social determinants of health within your organization. Once you screen for them, what do you do with that screening? Because oftentimes we find that healthcare systems are doing this incredible screening, but then there's nothing happening afterwards. So really starting to understand what that healthcare potential partner is doing. We also found that we started taking them some grant opportunities and saying, we've just gotten to know you, but we found this really amazing opportunity. We want to write for this grant funding. Are you interested in joining us? And we found that that's also really helped us to build trust and to build relationship with them, because now we're talking about how do our systems talk to each other. This is talking about, well, how do you really think we could refer to each other? And what does that system need to look like? And, oh, we want to do something in your ED. Well, what would that look like? And how does your ED really work? And so now we're really getting into how our systems are working. And then that we found has helped us to find more overlap for further opportunities to work together.
So that's so helpful, Lisa. This whole entire conversation has been extremely helpful, not only to individuals in Cleveland, but all over the country. So we thank you so much for joining us. Before we end, I did want to bridge the gap between Blooming Health and Benjamin Rose. For those of you that don't know who Blooming Health is, we are not just an engagement platform, but we are a fully closed loop referral platform that helps you all connect with your clients and make sure that um, are they receive the services that they're looking for. They're helping commit to those social determinants of health. Some of these that you can see on the screen are some highlights of the Blooming Health impact, but we've also partnered or been partnering with Benjamin Rose for about 2 years now. And we have helped them with their direct services, with increasing member engagement, with helping them send emergency communications, with connecting them to additional resources within Benjamin Rose as well. And just wanted to send this over if you would like a demo from us to see how we can help your organization connect with healthcare partners and community care networks. We would be happy to do that. But we wanted again to thank you all for joining us. Thank Lisa again for taking the time to meet with us and answer some really great questions and some really difficult ones as well. Again, I wanted to go back to what we talked about at the beginning. These conversations are important to connect and bridge the gap, especially in times like you mentioned, Lisa, during COVID, when we realized that we all need to come together. That hasn't changed. In fact, has probably increased with everything that's going on in today's society. So we would love to continue these conversations, to connect with each other, whether it's on LinkedIn